I asked pain researcher Rowena Field how a low-carb or keto diet can influence pain, and here was her response.
If we're thinking about like a low carbohydrate diet, you're sort of doing two things. You're reducing the glucose and you're also switching the fuel source over to fat. When fat gets broken down into ketones, that also has an effect on the body. If we want to try and link that into how that might influence pain, well, the problem with having a situation where we're getting spiking glucose all the time is that glucose, it likes to stick itself to proteins, but it doesn't only stick to proteins in the blood, it sticks itself to proteins in your tendons and your ligaments and your nervous system. So it has other implications in terms of how well they function. And I guess that's probably one of the important things to think about. We're looking at not only the inflammatory environment that the structure might be living in, but we're also looking at the quality of the structure too. And both of those things are influenced by the things that we eat. So that glucose, it can stimulate enzymes in the cartilage that cause it to degenerate and become inflamed as well. And just the fact that we have spiking blood sugar going up and down, those spiking levels are also an inflammatory process. So having a diet where sugar is going up and down all the time does set up this inflammatory situation, which is then problematic when we're thinking about, a pain problem, when we're looking at the structure that has to live in an environment that's a little bit more inflamed than what it should be. So part of the pain story is just reducing the glucose can influence the pain outcomes from that perspective. And then the flip side to that is that when we're using fats for fuels instead and we're breaking those down into ketones, those ketones, they are an energy source, so they act a little bit like glucose traveling around the blood, and all the cells can use that as an energy source. But as well as the energetic side of things, they are also a signaling molecule. So they act a little bit like a hormone that floats around in the blood, and when it gets to target organs and target mechanisms, it does certain things. And there's two really important things that those ketones do when we're trying to relate this to our pain story. That is, one is they block inflammatory pathways, and they also, they're epigenetic signalers for various things as well. So it's like you're sort of going back to the source a little bit and reducing a lot of the different inflammatory pathways that can exist. And the other thing that they do is that they can affect the sensitivity within the nervous system. So that's another problem that we've got with chronic pain, is that the nervous system is a little bit more sensitized than it should be. And so ketones seem to have this ability to just help to bring that back into normal levels. So when we look at how sensitive a nervous system should be, it's sort of a Goldilocks zone that it should sit in. We don't want it to be sitting too high, otherwise the nerve can fire all the time. And we don't want it to be sitting too low, otherwise it's too hard to get the nerve to fire when we need it to. And so what happens with chronic pain is it tends to sort of sit up on that high level, so it's tending to fire more easily than it should. And so we know that the ketones seem to bring that back down into a more sort of, stable level. And so all of those sort of mechanisms, I guess, are probably involved in pain management. We can't really, really say exactly what it is, because there's lots of different mechanisms in this complex system. There was about 170 different studies looking at what ketones were doing in the system, and there's about 14 different proposed mechanisms, and there's even been some more mechanisms proposed since we wrote that paper. So there's lots of things that might be involved in that process of the pain outcomes. So we don't really know, but something seems to work when we put people on a ketogenic diet.
Check out my entire conversation on episode 250 of the Run Smarter podcast.